welcome our first presenter, Sean Chua. Hi, Sean.
Hello.
How are you?
I'm good. You?
Are you gonna do a presentation? Are you gonna share screen or?
No, I'm just gonna read my essay.
Okay, excellent. Whenever you're ready, Sean.
Okay. So good day, everyone. I'm Sean Chua from the Philippines, and today I'll be reading my essay on the use of AI in COVID-19 response, entitled Beyond Bats and Electric Sheep. Manila, March 2020. Philippines strongman President Rodrigo Duterte just declared a nationwide lockdown due to the rapid spread of COVID-19 across the country. The echo chamber on social media platforms such as Facebook and Twitter would indicate this action as a decisive one. In reality, however, it's a little too slow, a little too late. In a month, COVID-19 had already spread to every single region in the Philippines, and cases continued to soar. In just a little over a year, the spread has resulted in more than 1.5 million cases and more than 25,000 deaths. The Philippines has consistently been ranked to be in dire straits. Despite having the longest lockdown in Asia, not only has the Philippines suffered significant economic losses, but COVID-19 has also wreaked havoc to many sectors of the country, with national healthcare at the brink of collapse from its core. As pervasive as COVID-19 is, it seems as if it cannot be stopped, merely slowed down. Yet, there's a beacon of light that's massively accelerating in crafting solutions to combat this angel of death. At no other time are artificial intelligence and data science being developed at such a rapid pace, resulting in breakthroughs in healthcare and medicine. AI and data science have been employed towards vaccine creation, drug discovery, disease spread monitoring and management, contact tracing, and mass testing efforts, among others. In the Philippines, the Philippine Red Cross, or PRC, utilizes AI and data science in countless ways. In collaboration with Y Combinator startup Dashlabs.ai, the PRC is able to monitor, provide, and predict real-time hospital information, including that of bed availability. At the onset of the pandemic, hospitals were quickly overwhelmed. Consequently, many were not able to find beds immediately, and some of those who waited ended up dying. To resolve this extremely concerning issue, a dashboard was developed providing essential real-time information such as location, contact details, and regular and ICU bed capacity on hospitals in the country. Using data science and AI, the platform also provides capacity predictions based on historical data, so the PRC can know where to direct availability requests. While predicting hospital capacities and bed requests can largely be considered reactive, COVID-19 response must more importantly be proactive. Enter clinical epidemiologists by AI. To predict the spread of COVID-19 in the Philippines, researchers from the University of the Philippines, or UP, and Philippine General Hospital, or PGH, use different epidemiological models for different cities within the National Capital Region. These models included a population density-based variation of the SIR model, an SEIR model, and another SIR model created by Darwin Bandoy and UP Los Baños. To aid in their calculations, the researchers used R0, or the basic reproduction number of an infection, in the aforementioned models. By running simulations, the researchers involved were able to create suitable predictions of varying types. On their own COVID-19 dashboard, they present projections for optimistic, actual, and pessimistic figures of the number of new cases based on a 7-day moving average. Another facet of COVID-19 response where AI is that of data integrity. The Electronic Case Investigation Form, or ECIF system, developed by the PRC, allows arriving passengers who enter their personal and travel details in advance to easily go through the testing process. They are able to monitor their specimen, get their test result, and receive a clearance certificate. In the ECIF, a photo of an identification document is required. While some passenger information may be taken from the text fields, passport photos remain vital as they still serve as the most common and trusted source of information for passengers. To extract the necessary information, passports uploaded to the ECIF go through AI object detection and optical character recognition, or OCR. OCR converts images containing text into text objects. This process is done for millions of passports, significantly fast-tracking authenticated patient data processing. We were able to build a fast and easy way to link these with mandatory swab tests for passengers without any special equipment. With the increased data accuracy from an originally manual encoding process marred with errors, every passenger got the correct result in no time. Aside from data integrity, data science and AI can also be used for analysis of large data sets. The Philippine Red Cross used this to implement mass testing at rapid rates. As we know, there are a number of tests that can be used to detect the presence of COVID-19 in an individual. Nasopharyngeal swab, reverse transcription polymerase chain reaction tests, or RT-PCR, antigen tests, and many more. Using data science, the PRC determined that the results provided by the saliva RT-PCR tests are not significantly different compared to that of a nasopharyngeal swab test. Due to this proof, the country's Department of Health has authorized the use of cheaper saliva RT-PCR tests as a viable replacement for the more expensive RT-PCR swab test, without sacrificing quality and accuracy. We've since seen an uptick of people getting tested, as testing is now more economical. At the very center of testing is ensuring that COVID-19 test results are as accurate as possible. Machine learning works by feeding an input called training data, processing them through some code, then the machine giving a decisive output to a certain degree of accuracy. Once again, the PRC and dashlabs.ai collaborated to design and implement a machine learning model to quickly and accurately recommend test results to pathologists. Nerd hat on. The model consists of an artificial neural network with multiple layers. About 48,000 pre-labeled test results were used for training the model and 12,000 for testing. The model's first layer consisted of a 135 neuron dense layer with ReLU as its activation function. A sigmoid function was also used as the network's final layer, which ultimately provided a quantitative measurement of the presence or absence of the virus for a particular test. Got it? Got it. The model achieved an accuracy of 99.03% for samples from the test set, a remarkable feat for the developers and the entire country. There are even more efforts by the Philippines to adopt AI in COVID-19 response. The Department of Science and Technology, or DOST, developed the Cherish App, which uses artificial intelligence and machine learning to provide an alternative diagnosis for the presence of COVID-19. In accordance with the DOST's thrust of AI for a better normal, this app analyzes chest X-rays to determine the possibility of a person contracting the virus via pneumonia. Foundationally, this app echoes one of the fundamental usages of machine learning, anomaly detection. In a nutshell, machine learning models can be trained to distinguish between images with varying characteristics. In this context, it would be images of healthy chest X-rays versus those showing pneumonia. In relation to the potential success of the Cherish app, DOST Philippine Council for Health Research and Development Executive Director, Dr. Jaime C. Montoya, said that once fully developed, this technology will be able to assist medical professionals by offering an alternative, scalable, and efficient mechanism that would augment the current workflow of our hospitals and testing centers to screen for possible COVID-19 infections among suspected patients. This could pave the way for a totally different future of healthcare. Other countries heavily use machine learning as well to solve other COVID-related problems. Benevolent AI, a UK biotechnology company, does AI-assisted drug discovery. Benevolent AI uses their AWS-powered knowledge graph that incorporates the entire corpus of relevant publicly available data and is continuously enriched by in-house experimental results. Together with their models, they are then able to gain clearer insights of the nature of a disease essential in finding drugs in COVID-19 treatment. From the results, they found that baricitinib, a drug often used for treating rheumatoid arthritis, possesses antiviral properties that can also be used in treating COVID-19. Since their discovery, baricitinib has been approved by the FDA for emergency use and proven to reduce mortality of hospitalized patients by 38%. Across the pond, researchers from Johns Hopkins University published the COVID-19 severity prediction model. Depending on certain information such as race, age, BMI, and comorbidities, the model can successfully predict how much a patient's condition worsens after a certain time period. Consequently, this enables better preparation by all stakeholders. There's no doubt that data science and AI have played an invaluable role in COVID-19 response, both here in the Philippines and around the world. The recent rapid developments in data science and AI, however, were partly born out of necessity. Why don't we make these developments and their pace the norm? Despite their fairly nascent nature, data science and AI seem to be the keys to revolutionizing lives worldwide. The 1968 dystopian novel asks, "Do androids dream of electric sheep?" We say, without the need to wait for dystopia, we need to quickly build AI that can dream beyond electric sheep. Thank you very much.
Thank you so much, Sean. I'm gonna now open up the floor to Tom and Daniel and Hande to give some comments. Tom, I saw your hand, or yeah.
Yeah, sure. Thanks so much. I found this essay really fascinating. So I think you offer a very positive picture of the power of AI, the power it has today to help us out, and the power it might have in the future to help us out even more. Do you think there's a kind of downside to AI as well? Are there any risks of relying so much on AI, and risks involved with so much personal data being available? What do you think?
I think on the analytical side, machine learning models tend to overfit when data fit a certain characteristic, or there's just too little data points. So there is a chance that too much reliance on AI could give inaccurate results. But in the case of COVID-19, there have been millions of tests developed. So I think with regards to accuracy, AI would still be reliable. When it comes to data, however, I don't know too much about how data security works in AI, but that would be up to governments and those managing large AI firms to make sure that data provided by individuals remain confidential.
Thanks.
May I jump
Hande,
in?
you want to go next?
Yes.
Yeah, please.
Yes. Okay. First of all, thank you so much, Sean. This was very informative and exciting to read. I particularly like your language, use of language. I thought it was very accessible and informative at the same time, and also figurative at times, and very well explained. Something I was curious about is you've touched briefly on potential collaborations in AI. So I was wondering what you thought about that, whether you think collaborations around AI across different countries would be something that could happen, or would that be something that would divide countries more so that each can actually have their own success in that regard?
I think when it comes to AI, political divide or any other human bias that we may have doesn't really affect it so much. The only way that it can potentially divide would be would depend on the type of data that is fed. So if data from one country is incomplete or inaccurate, when that's fed to an AI model, that could potentially be a source for confusion, not only for that country specifically, but also for other countries or other governments who rely on certain AI models. Yeah.
Thank you.
If I may, hi. Thank you so much for your presentation, and for it has been a pleasure to read your essay. And you can really see that you're passionate about AI and its applications. And I have the same idea as Tom's, that you have a very positive attitude towards it, and you stress a lot the advantages of it. Especially when in the end you propose or you advocate for a more extensive use, and to make the use of AI and in general data science the norm. Is there anything specific that you're thinking about? Have you thought of anything specific?
Maybe when it comes to, for example, transportation. I think although there may be some risk, like how Tesla now has their self-driving cars, and there have been cases of some technological like glitches in the system, but I think AI, in terms of risks, I think AI would still outweigh human drivers when it comes to, for example, reaction time. Because, for example, human drivers tend to maybe drive distractedly. Maybe let's say they're not paying attention, or they're texting, doing something else. I think that's what AI is there for. It's just to serve as a safety net for human drivers. And I think as the world is becoming more progressive, efficiency is key. So I think the intertwining of AI and transportation could be a great avenue to explore in the future.
Okay, in that case, let's give a big round of virtual applause for Sean. Congratulations.